Hi guys, uh, so here I am back with another Instagram Live clinical marathon. Today is the day for psychiatry, basically psychology class. Sorry, psychology class. We'll definitely clear things out in very soon, and we have a very special guest today. He is Dr. Farhad Adajania. He is practicing since 25 years. He has been associated with Dr. Farooq Master Sir, and to tell you that he has vast knowledge of psychology. I think in my life I have not met anybody in person with so much knowledge, and who is so humble. In spite of such a huge knowledge, he's so humble, and he's always ready to share. But again, even this gentleman uh, doesn't use Instagram, or doesn't like coming online. But after, as we have requested a lot of other teachers, so I requested him also that sir, please एक बार आप आ जाइए online, and to our request he has accepted, and he has accepted to come. So he is not a very Instagram friendly person, but today we will try and share some common problems which beginners, homeopaths are going to encounter in our daily initial practice. So let me just add him to this live. Let me just send a request to him. Guys, just stay tuned. I'm trying to connect, sir. Just stay tuned, guys. Yeah. Sir, we have you on the screen.
Yes. Hello.
Yeah. So welcome to this Instagram live series, sir. We are very thankful to you that you have accepted our invitation, and
Yeah.
we are all very keen. There are a lot of students who will be who have already joined, and there will be more and more who will join, and maybe they will watch later also. But sir, without wasting any time, we'll just start with the session, sir. So, can you help us differentiate what is difference between psychiatry and psychology?
Yes. And to share some of the clinical experiences, very simple, very basic clinical experiences that we see in practice. And these experiences were collected during the last around 20-25 years. And it's from the versions of the patients themselves that we've been able to gather these clinical experiences. Over a period of time, we realized in homeopathy that a lot of us are confused whether we are using psychology or whether we are using psychiatry uh, in relation to case taking, materia medica, the rubrics in the repertory. So, first and foremost, psychology was always more related to philosophy of the mind. That was in the earlier years. And at that time, what the person thought, what were his, all of that. Is the network okay now?
Yeah, yes, sir, absolutely.
Yeah. Okay. So, his way of thinking, perceiving, feeling, his inner life, all of that is what used to be was
Sir, can you please wait for 1 minute? So sorry, there was a lag and there was some network issue. So can we start again, please? My question was the difference between psychiatry and psychology.
yes. So the difference between psychology and psychiatry is that psychology is more about the inner life of the person. Psychology was first known as a study of the psyche. So the psyche was not just about the mind, but it was also very close to the person's soul. So the psyche had two meanings. One was that it is related to the soul, and the other was that it was related to the mind. And that is how philosophers also looked at the mind, and it was all about the inner life. It was about the introspection, about the person's thoughts, feelings. From there, slowly, gradually, over a period of centuries, it was also related to spiritual activities, to religious rituals, and to a lot of other things. In the last 150 years, what happened was that a lot of theories, a lot of philosophies of the mind were becoming too theoretical, and people were asking whether there was something a little more scientific about psychology. So they started looking more at scientific ways of understanding the mind and not just the theories. So, for example, if Sigmund Freud said that a lot of our thoughts, feelings, a lot of things are more unconscious rather than conscious, as he always shows the iceberg and the tip of the iceberg, that is our conscious mind, and the rest of the iceberg is under the water, that is the unconscious mind. So all of these were theories that worked in practice, that worked in a psychoanalytic clinic, yes, but they wanted more of scientific kind of working to be done in order to understand psychology in a better way, and it could be applied in a better way. So finally, the behaviorist came in, and the behaviorist said that only the external manifestations of your inner thoughts and feelings, which means that your behavior, the way you show it, the way you portray yourself, the way you react, the way you act, the way you respond, that is basically the best way, unprejudiced way of understanding what could be happening within. But the behaviorists never really looked into the thoughts and feelings. They said that could be a big mess because somebody may express their feelings in a certain way, somebody else may express their thoughts in a certain way. So we are not going to enter all that. We will only observe the behaviors. Person is angry, accordingly look at it. What is this pattern of anger? How is he reacting? What is he doing? And then came in the neurology and the neurosciences. So they started finding which neurotransmitters, which hormones, which chemicals were all related to anger, to anxiety, to feelings, to thoughts. So a science started building up. What was happening to the chemicals inside the body and what was the behavior that was seen. Slowly over a period of time now, people can actually act, react, respond, and whatever is happening in their brain can be understood with very, very, high sci-fi kind of basically experiments, instruments used. And today, even a functional MRI and various other instruments can actually help us to know what is happening in the brain while you are being angry, while you are being emotional. So it has come a long way from talking about the philosophy of the mind, of the soul, all the way till now. So a lot of mix is there now between the neurosciences, psychology, biopsychology. Lot of things are all today together. That is one part of it. But all of this, trust me, helps homeopaths, because whatever that we can gain by understanding, whether it is biopsychology, whether it is neurosciences, whatever little that we gain, even from those, whatever we understand really helps us in our case taking, understanding of our materia medica and various other aspects of homeopathy. Now, as far as psychiatry is concerned, psychiatry is basically more of a grouping or labeling a person's symptoms into disorders. So, for example, anxiety, say in psychology, we could say it is a vague feeling. I'm feeling unsettled. I'm feeling uncertain. I'm feeling insecure. All of that is psychology. But in order to say that this person is not just feeling uncertain and unsettled, just like any other individual, and that he is actually disordered, those symptoms have to be at a certain intensity, they have to be repetitive, they have to affect the functionality of the individual. It may affect a child's performance at school very drastically. It may literally lead to a person leaving their job. It may actually wreck up somebody's relationship. And those are the kind of drastic effects. If anxiety has that on your life, if depression has that on your life, or if you're a certain type of a personality for whom it is very difficult to adjust in society, to adapt in society, and it is very intense and it is affecting your life in each and every way, it is very drastic, then you call it a disorder. So psychiatry, when we say that हमने किसी का anxiety ठीक कर दिया, we have to understand whether that person really was suffering from an anxiety disorder, or which is according to the criteria of the American Psychiatric Association, the DSM-5, or according to the criteria of ICD-10 or 11, which most of the world follows. So if the disorders are according to those criteria, then we can say as a homeopath that we have cured or we have treated depression, anxiety disorder. Otherwise, depression, when used as a loose term, मैं तो depressed हूँ, is not really a psychiatric issue. Whereas a person who's suffering from more than 3 months to 6 months in such a way कि उसको सुबह उठने को नहीं हो रहा है, he is not able to, he has to literally push himself to work, he is totally demotivated, his self-esteem has become so low, he doesn't want to go out anywhere, literally काम छोड़ने की नौबत आ गई है. तो yes, this is a
then it
person
is
who is actually suffering
depression.
from a disorder of depression, and not just the usual way in which all teenagers who just meet in a club and say, "Yaar, मैं तो depressed हूँ." It is not like that,
Depression.
right?
So that's
This is basically the difference. But in homeopathy, now again, this is very very important for everybody to understand, is that in homeopathy साइकोलॉजी हम लोग ज्यादा यूज करते हैं. बिकॉज समझ लो, मान लो एक सिंपल एग्जांपल समझो, किसी को स्टमक पेन है, स्टमक पेन बहुत इंटेंस है, एसिडिटी बहुत सीवियर है, उसने दवाइयां की, एलोपैथी की, आयुर्वेदिक किया, सब कुछ किया, उसने एंडोस्कोपी भी करा लिया, एवरीथिंग द पर्सन हैज डन, they didn't find much of a real medical cause to it. So now we know that it is only his stresses, his neurotransmitters, it is his vagal nerve, which is all the time stimulating the stomach to create more and more issues, more acids, and more problems. Now, such a person, even though he may not fall into a psychiatric disorder per se, but understanding his emotions, understanding what is affecting his stomach, making him more aware during case taking. This is also very important. Many people become 30 to 40% better only when you point out to them कि भाई ये तेरा issue लग रहा है और ये तेरा psychosomatic connection है. And यहाँ से शुरू हुआ था, तो एक timeline बनाते, we make a timeline and see whether something has really affected a person in a certain manner, which is what we call almost as ailments from in homeopathy. कि अगर किसी को इंडिग्नेशन के बाद शुरू हुआ है स्टमक में पेन, एंड वी आर वेरी श्योर अबाउट इट, देन यस, we can take it as an ailments from, or we can just take even simple indignation rubric also, as well as ailments from indignation, and see what are the remedies that are covering up his or her issues, and we can give a better medicine. So
basically that's what we wanted, sir. That you're really highlighting things very well. That it's very common these days that patients just walk into the clinic and they say, I'm feeling very anxious, I'm feeling very depressed. And you rightly pointed out that we need to differentiate between psychiatry and psychology, and which is really very important. Sir, if you can explain it maybe a detailed way through any cases that you have seen, so we will try and understand how to enter a case. Suppose if a patient comes, and how to approach that patient. हम लोग का एज अ होम्योपैथ क्या अप्रोच होना चाहिए towards certain cases. So if you have any examples in such a way, maybe we'll understand things much better with that.
We'll start with a case of conversion disorder. Now, conversion disorders are not very commonly seen in practice. Conversion disorders generally in the past used to be always called as hysteria, and how hysterical women would suddenly faint or suddenly seem to get a convulsion when there was nothing on the EEG. The EEG is normal, absolutely, but it is a non-epileptogenic seizure. It has more to do with the hysteria, with the conversion disorder. Or some of them would say that their legs are just not working, or some of them would say they are so weak they just cannot get out of bed. So things like that, all of these used to be under hysteria in those days. It used to be called as that. But later on, conversion disorders were not just related only to women and only to hysteria, but it can happen in men also. And I will talk about such a case of conversion disorder today. And conversion disorders now, according to the DSM-5 also, they are not just related to women, but even men can have it, as long as there is a psychological distress in a person, or an unresolved issue, unresolved conflict, which the person, instead of verbalizing it or being aware about it कि मुझे ये issue है, just directly comes in the form of the symptoms of conversion disorder, which can be a lack of coordination, feelings of paretic or paralytic weakness, seizures, or similar kind of things, or a lump in the throat, and all those kind of, or the lump is not going down, how much ever I swallow, so things like that. Or rarely, जो अपने विराटरम एल्बम में जो सिम्टम है, that delusion that he is blind, basically it is just a sudden onset of tunnel vision or visual impairment, और चेक कराते हैं तो कुछ नहीं है, eyes are absolutely normal,
Fine.
but a person. So these kind of issues and symptoms, so this is a little different from just suppression of symptoms. This is not just suppression of symptoms, it goes a little beyond that, wherein a person suppresses symptoms, but at the same time the body suffers through all the neurological effects. और न्यूरोलॉजिस्ट के पास जाओगे तो कोई न्यूरोलॉजिकल इलनेस निकलेगा नहीं. So I'll try and keep the case a little short. It's a 56-year-old man. He's married. He has kids. He basically suffers from diabetes for a long time. From a certain short period of time, he's also suffering from hypertension now. He has a family history of his mother suffering from Parkinson's. This is some of his main significant history. Now, when he comes to me, he basically comes more for tremors. So tremors of the lower limbs, there is trembling of the face, there is also twitching of the muscles, sometimes in the lower limbs, sometimes of the face. Now, when this happens, it is not that he was anxious before the attack and then it happens. But when this happens, the anxiety becomes too much. He starts feeling as if he will not be able to move his limbs. So, for example, if he is, say, the network is still weak.
No, sir,
No,
absolutely.
okay.
It's going good.
So, so what happens to him is that with all this anxiety, trembling, twitching, he starts feeling that now he will not be able to get up from his seat. Or if he is standing or walking, he suddenly stands and he feels as if he is going to fall down. Or he just stands in one place with a lot of weakness of his lower limbs. Now this goes on for a very short period of time, just for very few minutes. And after the attack, he has a lot of weakness. So he has to just rest for 15 minutes, half an hour, and then he comes back to normal. But the anxiety that is created in him because of this is very intense, because he knows his mother has Parkinson's, which is quite advanced. And he sees it as probably I'm having diabetes, hypertension, so I'm getting into paralysis. But then he reassures himself that no, it is only happening temporarily, and then he gets better. So he went in for allopathy, got himself checked. Neurologically, he was all right. But this was not leaving him. He took homeopathic treatment for maybe 6 months, 1 year. He was still not better. Now, that brings him to me. Now, in the first consultation when he came, he talked about family disputes, about suppressing his anger, not expressing his anger. And whenever he thinks about the trembling, then the episodes of trembling happen even more. And he was dwelling a lot on negative events, positive events, sometimes thinking more of negative stuff. And there was a desire for sour, for lemons, for tamarind. He also has a desire for tomatoes, for raw onions, salads, rice, butter, meat. Basically, he is a foodie, and it was very difficult to really get to a point of, that what exactly. But rice, he said, is something which he enjoys a lot. Again, a little reservation considered it because of his diabetes. He was trying to control it also. So we don't know whether the rice desire was really a rice desire, or whether he was not able to eat much of it, so he was craving for it. Now, this kind of issues where how many marks to give to the symptom is a usual problem of our everyday practice. So wherever we are not sure, it is better to either put a question mark over there or to just mark it and keep it for the future, maybe confirm it again from some relatives or from the patient himself and take it. We should not just because say I'm considering staphylococcus aureus, so I will not consider the butter, I will not consider the sour, I will go for the rice and the onions and the meat. So why I'm telling you this is because homeopathy is a very, very tricky science. In your mind, the way you want to think about it, the totality can be seen according to that. So the totality mirrors your mind. So it actually mirrors your mind. It should not be like that. So as soon as it is doing that, अगर आप खुद का ही चेहरा देख रहे हो totality में, तो it's a big problem. You have to see patient's face in the totality, not your own face. So the totality is like a mirror. So you have to stop yourself, let the patient come in the forefront. Now I was confused between staphylococcus aureus and ignatia for him. And I was wondering what to do with him because he was not ready to divulge more information about his life. So for the first 1.5 months, I put him on a few doses of staphylococcus aureus 1 1 dose in a week. And I said, we'll see. So initially he came, he said the trembling is better and all, but the frequency of the episodes was the same. The feeling of paralysis, feeling as if you will not be able to get up, all that was the same. The anxiety that used to come up with that was the same. The weakness after that was the same. All of that was the same. So then after almost 1.5 months, he finally one day revealed that in 2005, his father died. So he had to take up the responsibility. And while he was taking up the responsibility, the relationship with his brothers, and it is an extended family, big family. So with one of the brothers was becoming a very big problem because of his behavior. And the patient would feel angry, would not show it. He was lacking sleep, the sleeplessness, along with a lot of brooding, introspection, thinking a lot, suppressing his emotions, because he had to be sort of leading all of them, guiding all of them, at the same time, being the one who supported towards them. But what about his own emotions? He was not able to resolve those conflicts. And he used to always control himself from undergoing outbursts. And the final result was that he would blame himself instead of blaming his brother. Now, this was the whole thing. So there was a lot of anger also. Then there was also something in his brother and his brother's family that they had done. There was a kind of an injustice. They had done certain unfair things. Again, he could not completely confront them and speak up with them. Now, listening to this story, finally, I decided to put him on ignatia.
Okay.
So after putting him on ignatia, the result wasn't very quick, but after 1.5 months, finally the twitching of the facial muscles became much less. The weakness of the lower limbs that used to happen, that used to freak him out completely, the anxiety, that all had become very, very, very less. And his other small issues, complaints that he used to get, those were also much better. And in general, his confidence levels were better. And that feeling that he's as if he would faint, all of that was basically, it was under control. And he has been on ignatia since then, since the last almost 6 months, and on very few doses of ignatia, as and when required, about 4 to 6 doses in a month. Now, these are all given directly, not in water, not diluted. And I've also kept it on because he has prostate and urinary issues for which he would like to basically reduce the medication. Plus, for his diabetes also, he wants supportive treatment. Also, his sleep is not very good. And unfortunately, his wife ended up developing cancer. And that again was a little setback. But fortunately, even though all this happened in the last 1.5 months, there was absolutely almost, he says 95 to 98%, he says literally no episodes at all. It's just like a touch and kind of go as if, probably it will happen, but it does not happen. So no longer the twitchings, the tremblings, None of that. All of those issues, the weakness, the paralysis feeling, all of that it has completely disappeared.
Sir, one very important thing which you highlighted, I think most of us juniors, a lot of my colleagues also who are there online right now are correlating to it, that whenever we are taking a case and we tend to then get inclined towards one remedy. Like you rightly said that instead of there are other things, but now because I am inclined towards Staphylococcus aureus, I might start giving in my mind that importance to कि onions है तो मैं ले लेता हूँ, meat है तो मैं ले लेता हूँ, अरे उसको insult तो था ही ना. So in such a case, how to maintain that balance, and when you said that the patient has to be in the front and not your inclination or not your thought process. So in that time, how to create that balance? Like अभी आपने बोला कि आपने पहले staff दिया, and then you change to Ignatia. One of my friend has a doubt which we will take it on later, that why Ignatia and not Natramure, because the grief was chronic. But sir, about this balance, if you can tell us in short something about this balance.
Okay. Now, this question actually has various factors in it. The first most important factor is the individual knowledge of the physician. So, abhi samjho ki some individual physician say has a very good knowledge of say 15 remedies
हाँ
and the rest of the remedies he uses them say in a therapeutic manner or in the form of mother tinctures or he
हाँ
uses it locally or whatever other.
हाँ
Now, in such a case, when such an individual is faced with cases wherein he or she has to know a little more of materia medica, little more depth into emotions, thoughts, psychology, and other aspects, wherein, say, now the second factor, the training part of it. Say the person has not trained himself or herself and has not been with a homeopathic physician whom that person sees taking up such kind of cases. So, for at least a minimum period of 1 year, if you are with such a physician and you see two or three most important things, like for example you observe that आज इन्होंने इस तरह से प्रिस्क्राइब किया और बाद में रिजल्ट 3 महीने के बाद इस तरह से आया है, तो दैट मीन्स ये जो टेक्निक था वो रिलेटिवली इज अ राइट टेक्निक. या ये अगर ऑब्जर्व करते हैं कि इस तरह से अगर टोटलिटी लिया है सर ने और इम्पल्सिवली दे दिया है प्रिस्क्रिप्शन और इस तरह से इसका नतीजा ये आया है. और तीसरी बात, कभी कभार यू विल सी दैट इवन द मोस्ट सीनियर फिजिशियंस विल डू स्टूपिड थिंग्स. सो ये भी सीखना है कि क्या नहीं करना है प्रैक्टिस में, बिल्कुल भी नहीं करना है, इसको टोटली क्रॉस कर देना है. नाउ दिस इज आई एम जस्ट जोकिंग, बट व्हाट आई एम ट्राइंग टू से इज दैट you should be very clear. You should observe very clearly, not looking at the fame of the physician, how many patients the physician has. All of that is of no importance. What is important is observing yourself, observing the other person, and अपने को result कौन से attitude से सबसे best मिल रहा है वो देखना है. So that is very important. And day to day में, as you will understand yourself also, that is also very important कि मैं कभी impulsive होता हूँ या मैं कभी इनसिक्योर हो रहा हूँ. फॉर एग्जाम्पल, आई बी वेरी ऑनेस्ट अबाउट दिस केस. आई वॉन्टेड टू प्रूव माई सेल्फ बिकॉज दिस फिजिशियन वॉज अ सीनियर वन इन माई एरिया हु इज नाउ लेस देन अ किलोमीटर अवे फ्रॉम हियर. ओके, एंड माई साइकोलॉजी एट दैट पॉइंट ऑफ टाइम वॉज कि इसको ठीक कर देंगे तो मजा आ जाएगा. You understand? So
yeah.
It is like a kind of a rush that you get, that
rush.
हाँ कि ये है जो है वो honestly बता रहा हूँ. So basically, so this
so we all go through this. We all go through this, and we are really liking कि आप exact feeling share कर रहे हो.
Yes. So this kind of, कभी अपने को sad feel होता है, कभी अपन insecure feel करते हैं, कभी अपने को proud feel करता है. All of this is very important, and you don't have to go into some big deep analysis. पूरा दिन बैठ के सोचना है, ऐसा नहीं है. If you are aware enough, you will see it at that point of time in itself only. Sometimes we are very proud. For example, once I had shown the case of a man with asthma and with so many dreams and this and that. Legacies से वो बंदा ठीक हो गया. बहुत chronic asthma था. It was literally since a very young age, and he was so good. And proudly I presented the case, and legacies was given, and the patient did extremely well. After a year or probably year and a half, he came back. He started coming back in typically the seasons which used to aggravate him. I took his case. Lachesis was not now working anymore. He needed a different remedy. In fact, he also started needing natrum sulf at a particular point of time. So what I'm trying to say is the attacks were not as intense as what they used to be. The use of the inhaler and all wasn't that much. But कहने का मतलब ये है कि ये सब जो भी देखते हैं over a period of time should make us very humble that today this person has come out of the conversion disorder with ignatia, but tomorrow he might need something else. You never know. He might go into sepia also. He might go into natrum mur. He might go into aurum. He might go into something else also. But so we have to be very clear and we have to be humble enough to understand कि चलो ये एक चीज जो है वो अभी के लिए ठीक हो गई है. आगे maybe you will need something else too. Maybe there could be other layers also which would come up and which could happen. Yes. Now the reason for choosing ignatia. Sorry, you are asking something, Abhishek.
Yeah, so Ignatia, maybe I wanted to ask you, sir, is there any because psychosomatic angle, but आप ये complete कर लो, sir. Ignatia, आपने क्यों Ignatia choose किया? Because that will answer the query also, the
Yes.
doctor who has asked it.
Okay. Now, if you read Phatak's Materia Medica, it is mentioned that nervous system is affected, causing spasmodic effects, violent with rigidity, twitching and trembling, paralysis after great mental emotion. अभी आप पूछोगे कि फाटक ने तो पैरालिसिस आफ्टर ग्रेट मेंटल इमोशन लिखा है, आप बोलते हो कि ये पेशेंट को न्यूरोलॉजिकल इश्यूज नहीं है, उसको कोई डायग्नोसिस नहीं है, खाली कन्वर्जन डिसऑर्डर है, तो ये सिम्टम कैसे ले सकते हैं? नाउ this is another very important part which I've observed in the last many years. Let's take the example of gelsemium. Gelsemium के जितने भी most important symptoms है, whether it is diplopia, whether it is drowsiness, or whether it is going into a stuporous state, lack of coordination, walking imbalance, all those things, we see it in a very bad case of viral fever also we can see it. We can see it in pre or post convulsions also. We can see it in psychiatric cases also. This is the pathogenesis of the remedy which can come up in various ways in different conditions. और जरूरी नहीं है कि जेलसीमियम को हम लोग खाली न्यूरोलॉजिकल कंप्लेंट्स में ही देते हैं. और दूसरी बात यह है कि इग्नेशिया के प्रूविंग में कोई इंसान एक्चुअल पैरालाइज नहीं हुआ था. Ignatia has in the provings symptoms similar to paralysis, and physicians who saw the connection between mental emotional issues, which means that grief, disappointment, jealousy, fright in Ignatia, which was or mental shock, that along with those peculiar symptoms, they found that it works very well, and that is how they mention paralysis after great mental emotion. So we have to understand that whatever you read in the Materia Medica, जो भी उसके इफेक्ट्स है वो अलग अलग बीमारियों में आ सकते हैं. So a person who can hardly hold his head up, who is becoming almost semi like almost stuporous, all of that can be in a person with a subdural hematoma also, where a gelsemium could work very well. And all of that could just be in another very simple case of flu or even a respiratory infection also. So one does not need to restrict oneself into reading Materia Medica in this particular manner. Ailments from anger with silent grief and not communicative. Now, not communicative is there in Phatak and Boric both. That not communicative and the introspective, silently brooding, that all put together is what we call the silent grief. अंदर emotions है, whether sadness है, anger है, जो भी है अंदर, whatever is there inside, that person does not communicate it, and the person goes on with everyday life continues their work, continues their responsibilities towards their family, towards their work and everything. बाहर से normal भी दिख सकते हैं, लेकिन अंदर से background में the noise goes on. That noise of emotions, thoughts, negative thoughts, whatever it is, everything goes on. That is basically what is silent grief. And some people may have silent grief with indignation, some people may have silent grief with anger, some people may have silent grief with anxiety about future, this, that, lots of combinations can be there. So now when the emotional outbursts are controlled, then you typically get a person who tries to cry but cannot cry. They get the choking in the throat. This is because Ignatia tries to control, and when it tries to control, you get the symptoms of what you may call a lack of coordination of muscles or contradictory effects, trying to but cannot speak, and all of those things happen. Sighing is there, wherein a person feels that enough breath is not coming in, still needs to take a deeper breath. Twitching is there. And one very important symptom that we see in practice in at least 40 to 50% cases of Ignatia is biting inside of the cheek and tongue, either while talking or chewing. So this is a significant symptom. The other one has to do with eating. A person you will find either refuses to eat, that person is also an Ignatia with psychological issues, or there is bulimia and there is eating, because there is a typical characteristic symptom in Ignatia, empty sinking in the stomach, not relieved by
eating.
So you eat, and sometimes what also happens in bulimia is the vomiting, and then you eat again. And sometimes there is a alternation in the same patient between anorexia and bulimia also. So these are some of the important symptoms of Ignatia. Just one more thing I would like to add. In the earlier Materia Medicas, it was always mentioned that natrum comes up as a chronic of Ignatia, which is true, definitely. But there are many cases who are only Ignatia also. Every Ignatia case need not be followed by natrum. In fact, 2 cases where I over enthusiastically thought of completing the cure with natrum got aggravated with natrum. So because there were indications for natrum, so I gave it thinking कि जरा और जल्दी हो जाएगा, you know, it will be still better. 1 साल हो गया, 1.5 साल हो गया, चलो उसको ये करते. But no, on the contrary, it messes up cases. So unless one is very sure that the natrum picture is really coming up, just because Clark says so, T.F. Allen says so, Herring says so, or anybody else says so, please don't do it.
Okay. Sir, I wanted to ask you that now as homeopaths and maybe because the patients are also well aware about, they read everything and they come. So now this psychosomatic thing has also started, people have started understanding, and we also try and correlate, and if they have not understood, maybe we try and correlate things to them कि ये भाई ये hurt हुआ था, कि ये आपको emotional ये setback हुआ था, उसके बाद से ये symptoms हुआ, तो this is mind, your mind is reflecting on your body. So if can you elaborate on maybe a case, or maybe you can you elaborate on this part, and can you explain this part to us, that how this psychosomatic thing can be approached, or how can we handle such cases?
First thing first, एकदम short में I'll tell you, psychosomatic का थोड़ा history है. Generally, what was happening was that while medicine was advancing, and as soon as they got a few hormones, and including steroids and antibiotics in their hands, what happened with modern medicine was that they became Marvel superheroes, and everything that could not be controlled or suppressed, they started left, right and center controlling it, suppressing it, treating it. And it was a happy state of mind. Now the only problem was that these same medicines would also be used for cases which were not so dangerous, or they were not so life threatening, and over there also many of these weapons were being used. And जैसे हाथी को सॉरी रैट को मारने के लिए हाथी का पॉइजन यूज करते, यू नो, इट इज लाइक दैट. So it was inadequate, it was out of proportion. Now these were the cases which they later on accepted after many years that these are the psychosomatic cases. For example, say asthma or very severe gastritis, certain joint complaints, polyarthritis, or people with chronic backaches, and you know, so they started realizing that a lot of complaints are related to depression, to anxiety. So they started sending these patients for talk therapy, counseling, or sometimes they would give anxiolytics, mild doses of anxiolytics, antidepressants, and they found that these cases were improving. The king of all is the irritable bowel syndrome, where they found that more than the remedies given, the drugs given for gastric issues, they found that Nexito was working better, you know, Librex was working better, things like that. So they found that giving a better sleep to the individual at night with Restil was making the patient wake up much better in the morning with less urging for stool. So they realized that there is a connection, and as soon as they've realized that, they have put those certain 8-10 disorders under psychosomatic
category
disorders. So now they also agree. Homeopathy में कैसा है कि we are not restricted to those 8-10 disorders. Homeopathy, right since the beginning, as Hahnemann's philosophy in the Organon goes, we anyways consider mind and body together. So it was, you can say, the very first champion of psych and soma together, and how the psych influences the soma, or sometimes even how the soma influences the psych. For example, we take ailments from head injury, and we look at the drugs. We look at natrum sulf, we look at hypericum, arnica, this, that, you know. So essentially, इंजरीज के बाद भी अगर किसी को मेंटल इश्यूज होते हैं तो वो भी अपन कंसिडर करते हैं, और अगर मेंटल इश्यूज से अगर फिजिकल होते हैं तो हम लोग वो भी कंसिडर करते हैं. सो फॉर अस इट इज अ टू वे स्ट्रीट. वी डोंट ओनली कंसिडर माइंड टू बॉडी, वी ऑल्सो कंसिडर बॉडी टू माइंड. से फॉर एग्जाम्पल, जोर से कोल्ड हवा लग गई and the person goes into an aconite state, gets frightened, becomes anxious, gets neuralgic pain on the face, सब कुछ वो एक घंटे के अंदर एकदम कोल्ड विंड लगना, एंजाइटी आना, पेन होना, everything happens together. The person needs aconite. In this case, anxiety did not cause the pain. The anxiety, the fright, the intense pain, everything came together after a gush of cold air. So कहने का मतलब ये है कि we are much beyond just psychosomatic disorder. We are using environmental influences which can give you mental and physical totality. एक सिंपल आर्निका का एग्जांपल ले लो कि आप गिर गए, आपको इंजरी हो गई, आपको घुटने में दुख रहा है, नीज में दुख रहा है, स्वोलन हो गया है, और आप किसी को बोलते हैं यार हाथ मत लगाना. नाउ दिस इंजरी हैज गिवन राइज टू द फिजिकल इश्यूज. विद द फिजिकल इश्यूज, योर थिंकिंग और योर फीलिंग इज आई डोंट वांट एनीबडी अप्रोचिंग मी. सो द होल कॉम्प्लेक्स ऑफ सिम्टम्स और सिंड्रोम ऑफ सिम्टम्स जो आ रहे हैं इस तरह से आ रहे हैं. So this is very important to understand that जब भी होम्योपैथी मटीरिया मेडिका में से हम देखते हैं, माइंड के लिए nowadays this fashion is there कि बस मुझे गुस्सा ढूंढना है, मुझे इंडिग्नेशन ढूंढना है, फैमिली टूट गया है क्या, ये हुआ है क्या, वो है क्या. It is not necessary. Sometimes a very significant physical cause can also lead you to the remedy. Sometimes, so from the environmental influence you can go to the mind and body, from the mind you can go to the body and environmental influence. Everything is there in front of you. Your behavior as a psychiatric patient can create environmental influences on your caretakers. और एक बार आप वो देख लिए हो, actually you have seen that. For example, say a psychiatric case needs China. This person is feeling tormented inside and he's tormenting his relatives also. Or a lysine patient एकदम रेज में जा रहा है, सब कुछ हो रहा है, उसको खुद को टॉर्चर्ड फील हो रहा है, वो दूसरे को भी टॉर्चर कर रहा है, चीजें फेंक रहा है, मार रहा है, सब कुछ कर रहा है. ओके, सो the whole thing is that यहाँ से आप अपने आप से environmental influence को देख रहे हो, behavior को देख रहे हो, उसमें भी वही remedy है. So we have gone way beyond just psychosomatic disorder. तो बच्चे जैसा दिखता है अभी. All these big things that they talk about psychosomatic disorders is nothing in comparison to what we have done in homeopathy for the last 200 years. It goes much beyond that. Now this, I'm sorry for digressing a little, but it is connected. No. What is important is कि हम लोग personality traits देखते हैं, which means that कि समझो कैलकेरिया का समझो symptoms आ रहे हैं. Say the person has desire for sour and sweet combination, great desire for sweets or eggs, or you see that the chili hai, you know, basically sweating of palms and soles hai, and basically the works, calcarea carb hai. लेकिन एकदम calmly बैठी है patient, कुछ दिखा नहीं रही है, insecurity, anxiety नहीं दिखा रही है, कुछ नहीं है, शांति से बैठी है. वो नॉट इज शोइंग, यू नो, कि जैसा ऑथर्स बोलते हैं कि यार इनसिक्योर होनी चाहिए, इनस्टेबिलिटी उसको फील होना चाहिए, उसको यू नो शी शुड फील लाइक दिस, फील लाइक दैट, उसको डरावने ड्रीम्स आने चाहिए. आप कुछ भी नहीं देख रहे हो उसमें. एट द मोस्ट शी मे हैव अ फियर ऑफ रैट्स, कॉकरोचेस और अ लिटिल बिट की इंजेक्शन नहीं ले सकती है, या ब्लड नहीं देख सकती है, या उसको वर्टिगो फ्रॉम हाई प्लेसेस है, विच आर अगेन ऑल सिम्टम्स ऑफ कैलकेरिया कार्ब. लेकिन इंटेंस नहीं है दूसरे सब सिम्टम्स जो आपको वो what you wanted to see, the core of calcarea का आपको core
जो हम लोग को inclination से देखना है.
हाँ, तो उसके पीछे आप पड़ गए हो क्योंकि यार वो बंदों ने सबने बोला है यार इतना तो मतलब पूरी हिली हुई होनी चाहिए, पूरी इतनी इनसिक्योर आंसरेबल, बट इट इज नॉट लाइक दैट. इस इंसान की लाइफ में ऐसे ट्रिगर्स अभी तक आए नहीं है. शी इज लिविंग अ वेरी प्रोटेक्टेड सिक्योर्ड लाइफ एज इट इज. So you will not be able to see all those traits. So you just take a few personality traits that this person is risk averse, does not like to take much of risks, lives in a protected environment. ये थोड़े बहुत उसके fears है, ये cravings है, ये chili है, ये है, पूरा totality है, and you still prescribe calcarea का. ऐसा नहीं है कि मुझे जबरदस्ती ढूंढना है उसमें, ऐसा नहीं है. It is not like that. That is the very first thing. So every time mental causation मिलना चाहिए, ऐसा कोई ऑब्सेशन रख के चलने की जरूरत नहीं.
So yeah,
should we go to the second case?
Yeah, second case.
Okay. This is an 18-year-old girl who suffers from psoriasis vulgaris, and she has gutted lesions since almost 7 to 8 years. Itching is a lot at night from warmth, sunlight. Now, when she came to me, she is from a poor family, and she was basically staying more at home, not going out anywhere. And her sister said that she is very reserved, doesn't talk much to anybody, but उसको गुस्सा इतना आता है कि छोटी छोटी बात पे वो डांट देती है, रूडली बात करती है, चिल्लाना शुरू करती है, and rest of the time again she is back to her self, being alone, reserved, and so most of the times she's okay if there is nobody around also. Now she was on cyclosporin, she was on Folitrex, and उसकी पूरी appetite, उसका weight, उसका growth, development, everything in the last few years was severely affected. It still did not help her. Most of her body, I think, except her back, rest of her body, she had eruptions of psoriasis, including on her face also. She was extremely irresolute, confused, very low self-esteem, could not make any decisions of her own, lot of fears, fear of insects, dark, injections. So we see three parts of this case. One is that she doesn't like much company. She likes to be alone. किसी ने थोड़ा भी provoke किया तो anger, shrieking, and becoming very rude, aggressive. And the third part of it is कि उसको खुद पे confidence नहीं है. So now, why I'm telling you this is that whenever we are taking a case, you can always look at the components of the case as you are receiving it. and you can mark it out so that you know which are the most predominant components. So her irresolution is not just irresolution, it is a very severe state of irresolution where she is totally confused, somebody else has to take it for her. That is coupled with her very low self-esteem, and that is coupled with her aggression and wanting to be alone. There were a few other general symptoms were there, basically of motion sickness, and there were a few others, and grinding of teeth during anger, sleeping on the sides, salivation during sleep, desire for chicken sweets, and all of that was there. Perspiration, palms and soles. Now, I first initially put her on a few remedies because I could not understand the actual remedy. I could not understand it, and she was very reluctant to talk. She would only show her eruptions, what was bothering her, and that's it. And all the history was given by her sister. So for some time, it went on with arsenic iodide 30, few doses in water, and then mesarium 30, and a few doses of natrum mur that I gave her. She improved. Psoriasis again came back. Again she improved again, and I was at a loss what to do with her. Finally, I just gave her Sorinum 200 in water doses. Again, she was better for some time. Then again, she said, no, I'm not better. Fortunately, one time she came without the patient. The sister came without the patient, and her elder sister finally told me that, so I asked her, I said, she always looks as if, she never smiles. It's like very difficult to, even get a smile from her, doesn't talk much. So she said, yes, she has a lot of anger in her. And all this anger, lack of confidence, thinking very low about herself, all of this, whatever that she feels, is because of the way she was treated in school. Now, this is very interesting. Listen to the timeline actually. So in school, she was a very bubbly person, very extroverted, very friendly with everybody, and never sad, reserved. None of those symptoms were there. She developed the psoriasis. As soon as she developed it, it was all over her body, very severe, and the scaling was so much that wherever she used to sit, from her clothes also, literally those scales used to fall on the bench, desk, everywhere. Now, she was in a municipal or in some public school, and over there the teacher could not understand that this was psoriasis. They tried to explain it to her, but she could not understand. So the teacher started feeling very dirty about her. और उसको लगा कि यार ये कुछ गंदी चीज है और अपने को सबको फैलेगा. तो what they started doing was कि वो जहां भी बैठती थी वहां कुछ भी करके उसको साफ कर देते थे, सैनिटाइज करने की कोशिश करते थे. फिर धीरे धीरे दूसरे बच्चे जो है उससे दूर बैठने लगे. धीरे धीरे she got absolutely one single bench and the chair on which only she would sit, and she was completely isolated from the rest of the class. And this affected her so badly because people bullied her, people hit her, and this went on for many years. From 7th standard till 12th standard, this is what happened to her. She was isolated, left out, she was despised by everybody, and she was made to feel as if you have something very dirty, very disgusting, and you are going to give it to others too. Now, from this particular state, I started her on lac caninum 200. Finally, we understood her desire to not be with anybody, her anger, her rage, with her aggression, the typical lack of confidence, the self-esteem being very low, and all of that suddenly started making great sense. Now, the psoriasis did not give her depression. The psoriasis did not give her the avoidance disorder. The avoidance personality came in mainly because of the way they treated her. And what typically happens in avoidance disorders is that a person will never go to any place where a person is going to be scrutinized or looked at or criticized or judged. So she completely shut herself into her home where nobody could despise her, criticize her, nothing of that sort would happen. So the avoidance issue was actually, as a psychiatric issue, was created not so much even by the psoriasis, but by the treatment, the environmental treatment. Now, in this case, it is very important to understand that contemptuous towards herself, feeling that she is dirty, disgusting, and all of these things were not actually her own inner symptoms. This was created by or triggered by the environment, right? So there are cases like this also, where a person may not start being a lac caninum necessarily. In fact, the environmental influences create this kind of a state in the person. And it is very important to remember that most cases of depression, schizophrenia, and many other psychiatric issues are usually related to absolute lack of love, lack of empathy from others, and isolation. In fact, in schizophrenia, isolation is supposed to be one of the most important factors that even triggers of schizophrenia in a person who has a potential to develop it. So this is very important in psychiatric issues, and I feel we should study at least 50 to 60 main remedies of forsaken feeling, and also the delusion rubrics that are close to the rubric of forsaken feeling, and the connected rubrics, because it really helps us in our practice. It is still very difficult to differentiate. It is still very difficult. I'm not saying it is easy, but as much as we can differentiate, and if we have physical symptoms. Now, unfortunately, she did not have cravings of lac canine. She doesn't like hot drinks. She does not like pungent food, pepper, and all those. She didn't have any of those kind of, desires that you would look for in a lac caninum. Her sister mentioned when she had come without her that she also had a history of recurrent tonsillitis. But yes, it matches lac caninum once again, but that could be any other remedy also, like a calcarea carb or a lycopodium or any other. So, and the antagonism within herself, that is also very important in lac caninum, where you cannot decide. Antagonism should only be taken where a person is so confused as to just cannot decide at all and has to completely depend on somebody else to make the decision or to approve that decision, and finally with great hesitation they will take it. So it is much more than irresolution. Irresolution can still to some extent come to an understanding, but antagonism is very intense. It is like two poles, opposite poles, wherein they cannot decide. It cannot be integrated. So that is very important in antagonism. And after lac caninum, her itching and everything completely subsided. And the best part was she only needed 3 doses. The water doses, only 3 doses. And only the marks are there now. But the scaling and everything else, for which I was struggling with mesarium and with sorinum and this and that, which I was only doing because I wanted to help her. Because also a very poor person, and I did not want to send her again to another dermatologist or another, because it was of no use. She had already taken the highest drug. There was no point of sending her again somewhere else. So I was just waiting for the opportunity to see that very carefully, giving her doses so that her psoriasis would not get suppressed. She would not have other issues, which fortunately did not happen. These remedies just relieved her, and I was waiting for the right time so that something could come up and we could, get a better totality.
Okay. Thank you so much, sir.
Yeah.
So is it okay to continue for 10 more minutes? Because
Yeah, sure.
it is, sir, in this case, at which point you entered into lac caninum? What is the
I'll tell
peculiar
you.
symptom?
I'll tell you.
Yeah.
I'll tell you. Now, in Fatak again, I have purposely taken down these symptoms. I've just written them down on a chit of paper today morning so that you realize how important simple materia medicas like Fatak materia medica they are. So, Fatak mein it is given, one's own body seems disgusting.
Disgusting.
And he gives things himself of little consequence. Now, thinking oneself of little consequence has to be understood a little bit. It is, yes, it talks about low self-esteem, and it talks about the fact that दूसरों के बराबर तो मैं कुछ भी नहीं हूँ, but consequence also means that मैंने अगर एक बार कोई चीज ठान ली, मैंने अगर इंटेंशन है, even if I try to be determined, and अगर मैंने एक्शन कर भी लिया, तो वो एक्शन विल बी ऑफ लिटिल कॉन्सिक्वेंस, विच मीन्स दैट उसमें कोई कुछ बड़ी बात नहीं होगी. या तो मुझसे वो होगा ही नहीं, या तो वो फेल हो जाएगा. Fear of failure is also very, very marked in lac canine. And also a fixed feeling that even if I try, I will fail. Or there are very high chances that I will fail. So this again comes back to self-contempt. And this self-contempt in lac caninum, in at least 20-30% of cases, in young girls and women also of a certain age, we see it in abuse cases. Abuse cases is very important in lac caninum, whether it is physical abuse, the way this girl was abused mentally and physically, कि वो उठेगी तो उसकी जगह सैनिटाइज कर देंगे, उसको गंदा फील कराएंगे, बुली करेंगे, मारेंगे, या तो sexual abuse also. Sexual abuse from a family member, or sexual abuse by a servant or a helper who was there for a long time in the family. So all of this can create this kind of self-contempt, the dirty feeling, and loathing oneself. Loathing oneself means that मुझे खुद के लिए ही कोई अच्छा फीलिंग नहीं है, होता है, नहीं है, and I don't feel anything good about myself. Now there is a delusion in the repertory, the delusion, disease, loathsome, horrible mass of disease he were a. Delusion, disease, loathsome, horrible mass of disease he were a. And this is exactly not really the feeling of the patient, but what she was made to think. So now this brings us to another interesting point, that delusion जब भी select करते हैं तो different तरीके से select कर सकते हैं. Delusion need not always only be the core delusion or a primary delusion of the patient himself or herself. It could be the state that the person is in, or the way they are made to feel. For example, licensed state can come up in a person when they are treated very badly, very scornfully by the person on whom they are dependent. So जिस पे आप dependent हो, not necessarily कोई financially dependent होगा, कोई emotionally, कोई morally होगा, जो भी होगा, but जो भी dependence है, mentally या physical, वही इंसान आपको टॉर्चर करता है, वही इंसान आपके साथ गलत करता है. So that basically creates the feeling of having suffered wrong, of feeling tormented. So basically outside factors can actually create those states within us. Another example of outside states I can give you is simply staphysagria. Staphysagria, say if he has a boss who is full of, he's all the time angry with him, putting him down, उसका mortification हो रहा है, staphysagria patient का, उसको promotion नहीं मिल रहा है, उसको raise नहीं मिल रहा है. So basically the textbook picture of staphysagria, all of indignation, anger suppressed, mortification, and this is the story. At the same time, staphysagria cannot leave the job because of his loans, because of some other targets, financial targets, or for his child's education, whatever it may be. He's not feeling confident that he will get a better job, or whatever that it may be. So he cannot leave it. Now, this is what creates the delusions of staphysagria. And there are places where staphysagria feels that family will starve, he will starve, all these feelings that he gets. And there is also money matter anxiety in staphysagria. और ये जो job है, उससे कम position वाला अगर उसको job मिला, तो again he'll still, मतलब उसको demotion हो गया उसका, तो that demotivates him even further, कि जो position से था उधर से भी कम हो गया. So things like that. So he will not leave the job even though it is miserable, even though it is giving him a lot of sadness, suppressed anger, everything, he still sticks with it out of insecurity. So a lot of delusions are more of mental states of a patient, which 50% of times are created by environmental influences and 50% of times comes from the individual himself or herself. But now the most important differentiation is that in psychiatric cases, a densely psychiatric case, environmental influence can trigger it, but later on जितना भी जो भी out of proportion delusions, anxieties, fears, imaginations जो भी आते हैं वो सब illness से आते हैं. All those come from the illness. That is very important to understand.
Okay.
Yeah. So, say if a lactinianum has turned, say, going into schizophrenia, then all the delusions, as we know in lactinianum, whether it is of snakes or horrible looking faces and this and that, and so all of those things from the unconscious will start erupting. So all of that will start coming up. Then there need not be still further fright coming from the environment or anger coming from the environment or none of all of that. Even by itself, the illness promotes all these kind of delusions and fears. Then the real challenge starts कि मुझे कौन सा delusion लेना है और कौन सा नहीं लेना है, because some of them will be very common to the illness. So to get those which are more individual based, then that becomes the challenge. That is the thing.
Okay. So it is 70 minutes almost. Guys, there is one more question that I wanted to ask, sir. If you all are ready to just be there, we will, sir, how this is Dr. Naira asking, sir, how do we differentiate between rubrics forsaken feeling and delusion forsaken?
Okay. Now, forsaken feeling is like a blanket rubric, which means that जहाँ भी provings में या रेपर्टरी में दूसरी जगह पे भी जो भी rubrics है which are very close to forsaken feeling, वो सब drugs अभी जो है पूरे के पूरे forsaken feeling में डाल दिए. अभी complete रेपर्टरी अगर आप देखोगे तो उसमें forsaken feeling के जितने drugs हैं उसमें से आधे ऊपर के तो नाम मैंने खुद भी नहीं सुने. So it is so vast now. It is like a blanket rubric. Forsaken feeling मतलब पूरा उसको कवर कर दिया पूरा का पूरा. So don't get confused with the general forsaken feeling का जो rubric है. Delusion forsaken जो है is a more of a intense state within wherein a person actually feels that he is alone. Now, for example, जैसे rubrics है कि I am feeling separated from the world. Now, the person is not actually separated from the world, but उसका जो deep inner feeling है, that is what creates that separation, or that if he is an outcast, it is his understanding about the whole thing that is what creates it. So the delusion becomes like a very intense fixed idea which the person has. Forsaken is just a general blanket term for anybody who feels lonely and that way. Delusion forsaken is far more intense, and जहां पे उसको नहीं भी फील होना चाहिए वहां पे भी उसको फील होता है. So that is very important. And just the last thing, many rubrics have also been taken from sensations as if of Roberts. Many other rubrics have been taken from other places in Nair and other places. So the way they were represented over there, they have been put under delusion forsaken. Okay. So if you see how it is arranged, it is not a very major difference between the two, except the fact that the intensity is much more in delusion forsaken. And a simple last example I'll give you if that helps you. Supposing, let's say that another child comes into the family. Now the child starts feeling jealous. With that jealousy, the child starts feeling lonely. Okay? मेरे डैडी मम्मी मुझे neglect करते या मुझे प्यार नहीं करते. Now for such a child, actually delusion neglected is a much deeper rubric. Actually delusion forsaken is actually what it is. Because किसी ने उसको अकेला छोड़ा नहीं, फिर भी उसको ये फीलिंग
लगता है
हो रहा है. So I hope you can understand that this is how the delusion forsaken is a very intense and sometimes not required feeling also, which can come up because of your perception, essentially.
Okay. Are there any other questions? If somebody wants to come up with any questions, any more questions? Okay, sir. If we can just very quickly, because I don't want to skip this topic of anxiety. Okay, Dr. Naira, your doubt is clear. So, sir, approach to anxiety cases, because this is very, I think the most common. I feel very anxious. I feel very uneasy. I feel, and many of times they don't even describe it. So this feeling which is not being described or which is anxiety, how do we approach such cases, and what remedies will be very helpful to us in such cases?
Okay, एंजाइटी को पहले तो समझना है. Many anxiety cases will be wrapped or it will be connected with a lot of irritability or anger. A lot of anxiety cases are connected with sadness also. Lot of anxiety cases are just anxiety without any reason also. A general feeling of anxiety, what we call generalized anxiety. So anxiety comes in different forms, or anxiety after the illness has developed. अभी तो मेरा bypass हो गया है, मेरी तो जिंदगी अभी तो ऐसी है वैसी है. Though the doctors have told him no, you can start going for walks, you can do yoga, you can do whatever you want, but the person has developed an anxiety that अभी तो मैं पहले की तरह खा नहीं पाऊंगा, कर नहीं पाऊंगा कुछ भी. So different types of cases में एंजाइटी होती है. तो फर्स्ट ऑफ ऑल द पर्सन्स सिचुएशन इन लाइफ, व्हाट इज द पर्सन्स सिचुएशन इन लाइफ इज वेरी इंपॉर्टेंट. सो और वो सिचुएशन में एंजाइटी उसको क्यों हो रहा है, दैट इज वेरी इंपॉर्टेंट. फॉर एग्जाम्पल से if a mother has an autistic child she has to take care of and she's anxious about the child, so that is basically the anxiety in her case. Or if a person has a fear of losing the job, then that is the anxiety, creating the anxiety or other anxiety associated symptoms in that case. Situation क्या trigger कर रहा है, first thing. Second most important thing is कि family history है कि नहीं है. Like you will see many people जिसकी mother भी हमेशा anxious हुआ करती थी, अभी बेटी भी anxious type की है. I have a case in which the father is a total hypochondriac, and out of the two sons, one of them is okay, the other one is absolutely hypochondriacal, just like the father. So family history है कि नहीं है, वो भी जरूरी है. Along with anxiety और कोई associated उसको problems है क्या, जैसे कि हाथ धोते रहते, साफ करते रहते, कोई OCD या OCN के symptoms है क्या उसको. Anxiety thoughts के कारण हो रही है क्या, मतलब घर पे नहीं आया, एक्सीडेंट हो गया, ये हो गया, things like that way. Now there are a few people who have tremendous anxiety about losing people on whom they are dependent, whether financially, mentally, emotionally, जो भी हो. तो that also you have to see whether anxiety उसके कारण हो रही है क्या. Like recently we had seen at the HHC, we had seen a case of a guy who had been to the astrologer, and unfortunately the astrologer told him that even though your father seems to be perfectly okay right now, 1.5 years is what I give him. After 1.5 years, ऐसा मतलब उसको prognosis दे दिया, astrological prognosis, कि he was finished. So now tremendous anxiety in this guy. As it is, he was anxiety prone, but then he became totally freaked out, एकदम freaked out. And now imagine living for 1.5 years. उसने अपनी पूरी लाइफ जो है उसके हिसाब से सेट की कि वो अहमदाबाद जाने वाला था, लेकिन उसने अपने आप को रोक दिया, मैं अहमदाबाद नहीं जाऊंगा, मैं काम को एक्सपेंड नहीं करूंगा, मुझे डैडी के पास रहना है, यहाँ पे होंगे, कुछ हो गया तो क्या होगा. So one basic idea given by a person created so much of anxiety, it almost turned into an anxiety disorder for him, affecting every part of his life, including his relation with his wife and everything, total. And his main anxiety was कि इतना business हम लोग ने फैला के रखा है, is only me and my father, something happens to my father, how will I take care of the business, settle affairs, everything. So in total, his attachment to his father, the business issues, everything. So totally was putting him into a. So this one thought that a person puts in another person's mind, and this can be the level of anxiety that is
Okay.
created. The third thing that we see is which part of the body the anxiety happens. Like generally, when you ask, the person will say they feel it in the stomach, they feel it in the abdomen, or they get trembling of hands, or they get twitching of muscles, या head में feel होता है, या जो भी feel होता है, that basically is also essentially a part of anxiety, and it is very important. Sometimes you get very important sensations also from that particular location where the person feels the
Anxiety.
anxiety. So sometimes it can become extremely useful. Like even in people who need serpent remedies, many a times with anxiety, they will talk about as if somebody has tied them up, or somebody is totally pressing them down. Yeah, constricted feelings hote with the anxiety, and many a times you'll see these kinds. So sensations are very important when it comes to anxiety.
Okay.
And
And I think
if
accordingly the remedies will every time when we
yes,
match all these things, I
yes.
think the remedies will
There
come
were
up accordingly.
only two cases up till now in the last 25 years. One was, and both Baraita Kab, and one of them had told me that, I said, what will happen? She used to always say, without my mother, anxiety. So I said, what will happen? So one day she just told me, when she was talking about her sciatica, she said, what would you feel like if both your legs are not there? Will you be able to walk without your legs? And that's typically the delusion legs cut off of
Delusion legs cut
Baraita
off.
Cup. And after
Bharata
so
Cup.
many years, this was about maybe 15 years back, and recently this year again, I heard it from one more woman who was also extremely attached to her mother. Her mother died now, but so she's alone. And when I asked her, she said, I feel as if both my legs and hands are cut off without her, as if it's not there. So
Okay.
you do get certain delusions, certain sensations. Sometimes it's rare, you don't get it all the time, of course, but what is mentioned in the Materia Medica is not crap. It actually has a lot of significance, and sometimes, yes, you get some really beautiful symptoms and rubrics. If people are a little more aware, if they are ready to answer, then yes. But give importance to sensations, and it's a little more in details we can't discuss in total details.
Yeah, yeah. Because there were some other questions also about dual personality. But I think there are so many topics that we need that we need, but the time is limited. So I think I think we will conclude to this session now, and we will like all of us in on behalf of everybody. I would like to thank you that you spared your precious time on a Sunday morning. So thank you so much, sir, for giving your valuable time. And it really was an insightful session. We really learned a lot, and I think when once it gets posted, obviously we were approximately 40 people there in the live, but more and more people will watch it, more and more people will benefit, and I hope we will get those who are watching this will get new directions of how to exactly approach those cases. So once again, thank you so much, sir.
Thank you, Abhishek.
Bye bye. Bye bye.